And when it comes to, as a doctor, what have you seen over the years in terms of society accepting mental health challenges and being able to seek help? Be honest.
Yeah.
Yeah, like a society, meaning all of us, me, you,
Okay.
everyone.
Yeah.
Because like I said in the beginning, I didn't grow up knowing these things, knowing that people had mental health challenges.
Yeah.
I've just learned them now. I'm older, now that I'm a parent, now that I have kids,
Yes.
now that I've also opened up my mind and said, okay, this thing is real. So what has been your experience over the years?
Yeah, I think a few years back it was not a very open subject to talk about, but now people are becoming a bit more aware, a bit more accepting. There's also a lot happening in terms of creating awareness. There's no need to hide your person.
It's a disease like any other disease.
And it's not a respect of persons.
It's not a respect of person.
The myths are beginning to become demystified, like maybe one of the most common African myths is umerogwa.
Umerogwa, you're right.
Yeah.
Ama inafaa uko kwenyu na watu wa kwenyu.
Exactly. And that's quite stigmatizing because by the time someone tells me hiyo ni ya watu wa kwenu, already you're looking down upon yourself, your family.
Unasema hata nimejiva, sasa hivi ndio tunakuanga.
Yeah.
You know, whatever fate the rest had, I'll wait for that fate.
Yeah.
So you don't feel that motivation to
Exactly.
No one is telling you, giving you hope that it can be dealt with.
It can be dealt with. Yeah, so there's no need to hide your people. It's a condition just like any other. The same way you can be diagnosed with diabetes or
high blood pressure,
or hypertension, and you take medicine. And for some conditions in the mental health field, you will be on medication for quite a long time. It's the same thing as that.
Yes, you have to take your medicine, like we're talking about it. You know, you can't say, oh, today my sugar level is okay, I will not take my diabetic medicine.
Exactly.
You have to continue. It's tiring, yes, but you have to continually take it.
Yeah.
You have to embrace a change of lifestyle.
Yeah.
You have to have another level of self-awareness.
Yes.
So it's a condition like any other condition.
Yes, it is. Yeah. So like that aspect of it being tiring, that's why we are here as a hospital to provide support. We understand that when someone has a chronic condition and you have to take medicine every day, it can be tiring.
It is.
You know, especially if someone doesn't have, like they have not accepted fully that this is a problem that they have. Just come down here, we talk about it. Do you know even just one therapy session can help?
Oh, it does make a big difference.
Just one.
Yeah.
You don't have to go through the whole process. Just coming for one therapy session, talking to a professional,
understanding yourself better. And finally, I know what I'm suffering from.
Yes.
You know, there's nothing as frustrating as not being able to understand yourself. The people around you don't understand you. So now we are all lost, yeah? So we're operating on frustration, on getting tired of each other. We are fighting. So once you understand, what am I suffering from? How can I, and the thing I like about you said about talking and therapy is that other than sometimes some condition might require drugs, I know that you also really, you also focus and put time in someone being able to find coping skill, coping mechanism, understanding themselves, what triggers them.
That's actually what we do here at Oasis, and it's done by various professionals. So there are psychologists on board like me who take people through psychotherapy to help them understand, okay, so there's stress in life, but how do we cope better with it? Especially because we know that there's an underlying problem. Let's just say the most common thing is depression.
Yes.
First of all, what are your warning signs? What things do you start experiencing for us to know that probably you're not in a good headspace?
I am dipping. I am sinking.
Yeah, how you need to identify those things that create self-awareness. Then there are coping skills. So what can I do differently to go through a challenging situation
and be able to manage it better than last time?
Exactly.
It doesn't mean that it won't affect you.
Exactly.
But the point is, am I managing it better than last time?
Yes.
So meaning I am gaining coping skills.
Yes. Yeah. Then we have something called occupational therapy here at the facility by one of our occupational therapists. She's the head of that department. What she does is she engages people in activities to promote what we call activities of daily living. You had mentioned something about how when someone is doing very badly, you can start seeing they're not showering anymore.
They stop taking care of themselves, they stop going to the gym, they're not eating healthy, they're neglecting. You know, things they used to enjoy before, they are not doing it anymore. you.
Exactly.
For me, that's a very big sign. As a mom,
Yeah.
that's a very big sign to look out for.
Exactly. So what this occupational therapy does is she engages those patients using activities to help promote those activities of daily living. Activities of daily living are simple things like, are you able to brush your teeth? Are you able to make your bed? Are you able to socialize with people? Because human beings are social.
Yeah, well, we're social beings.
Exactly. So what she does is she uses activities, in short, games. When you come to Oasis, there's no time you'll not find the patients engaged.
I've just seen them. Others are doing art.
Exactly. Our walls are full of what previous patients have done. And that, can you imagine, promotes that. It promotes social skills because we are a very family-oriented hospital. The chances are very low that you come to Oasis and you'll not find a friend. The chances are very low you'll feel isolated. Somehow we are able to promote that feeling of oneness. So when people come, we do group activities, a lot of group activities, playing games, things like Monopoly, things like chess, things like Ludo, cards, playing outside at the basketball area. We have a table tennis court. I mean, that's one of the special things about Oasis. We have an occupational therapist who promotes activities of daily living, and I mean, once you come here, you begin to understand, wow. So I can actually, and there are so many people who are just like me.
And I like the fact that, you know, I've come maybe here and I wasn't able to achieve much or able to complete maybe a task, and then I come here and let's say I draw a picture, I color it. I'm proud of myself. I start regaining my confidence.
Exactly.
And imagine I can achieve something.
Imagine.
I'm so excited to get back to being productive.
Yeah.
So someone might say it's a small thing.
Yeah.
But from someone who's coming from a dark place,
I'm
able, slowly by slowly, I'm able, then if I can draw a whole picture, paint. What about tomorrow if I can wash my clothes?
Yeah.
What about tomorrow if I can cook food?
Exactly.
So you see those small steps. So then when they go back to real life, they're able to pick up again.
Yeah, because now you're motivated. You're like, wow, yesterday I did this. It's up on the wall. Tomorrow I can do something else. So, I mean, holistic care. We give patients holistic care. There's a doctor who gives medication if need be. There is a psychologist who takes them through talk therapy. Then there's an occupational therapist. There are the nurses who provide a lot of support and friendship also, just talking to people, and medication, giving of medication, making sure everyone is okay. They are very good at that. Then you have the kitchen who make amazing meals.
Because also you have to give them a balance.
You do.
Because also, like you said, it's holistic. When you're going through, just the same way, you cannot be suffering from diabetes and I'm taking Coke. Yeah. So even if I'm suffering from a mental health, let's say I'm suffering from a hyperactivity, and then I go eat food filled with sugar and fat, then I'm not supporting my my condition and my process of coping and trying to understand myself.
Exactly.
So I like the fact you mentioned the food because I'm sure food plays a big role in different conditions.
It does. Like for example, I don't know if people know this, but you know when you have anxiety and you take a lot of coffee, it doesn't help.
Coffee, Red Bull, let me just say
energy drinks.
Energy, coffee, Red Bull, Monster. I really, like, it is one thing I do not like by those things because sometimes you find it just adds the anxiety.
It does. It makes you feel more apprehensive. Antsy, exactly. So, I mean, because we have a wonderful team
that understands that,
you
so
receive proper care.
We provide, no, it's holistic, so we have all that.
Yeah.
Okay.
Yeah.